Hi, Andrew Zang, Physical Therapy here, and today my question is for individuals who have back and or maybe hip pain. And that specific question is, what is the source of the pain? Is it the back, is it the hip, or is it a little bit of both? And honestly, in practice, it often can be a little bit of both. But the only way to know for sure is to have a thorough examination. And what constitutes a thorough examination? That is something that is very important. Is it just standing there and having an x-ray taken of your hip and or spine? Is it going to have an MRI of your hip and or spine? So many individuals have had these advanced imaging tests done, and they have surgery on one body part or another, only to have the pain persist because the decision to treat was based on imaging alone and not an actual physical exam. This is not something that anybody wants to experience, to have a new hip put in only to realize that their hip pain was caused by their back, or to have spine surgery done only to realize that it was a hip issue. Okay, so don't be that person who relies upon advanced imaging only, because if you do and you don't have a good thorough exam, something may get missed and you may have a wrong treatment path selected for you, only to be stuck where you are and not improving in terms of your overall function. So what is that good exam? Well, the doctor or therapist or medical practitioner should have their hands on you. They should feel your movement. They should watch you move, see how they respond. Not only that, but ask key questions. You know, for the hip, does it hurt to cross your legs? Can you rise from a chair? Can you squat down to pick up a bag of groceries or that laundry basket? You know, those are key questions that can be asked that can help someone like me determine if it is your hip or possibly your spine. And like I said, sometimes it can be both. You know, lack of motion in your hip joint when you're walking, for instance, will then impact how your gait looks like. And when your gait becomes impacted, that could translate up into your spine and thus cause some spinal discomfort. So in this case, while you do have back pain and some hip pain, the source of it in this case would be the hip. So we treat the hip, improve that's mobility and strength, help you to walk better, and then that back pain goes away. Okay, and for other individuals, the true source of it could be the back, and then it just radiates into the hip. And you won't know that without having a medical provider asking specific questions and physically testing on you, putting their hands on you, testing you, feeling how you move, listening to your response. If the medical provider doesn't give you a chance to answer the question, or they're just looking at a sheet of paper, just checking out boxes, that's probably not the provider for you. You need someone who's going to listen to you, to learn all about your problems, what you can't do, what you want to be able to do, and to take the time. Pulling apart these issues is not done in a 5-minute consult. I'm sorry to say, it's just not going to happen. The world we live in, people live with their pain for so long. So everybody who comes in my office, I have a pretty high pain tolerance, but somehow they do end up with me. So somewhere along the line, you reach a breaking point and you seek help. So when you seek help, look for a provider who's going to take the time to listen to you and to dissect your problem so you get to the root cause and treat the root cause, not just a symptom. Treating the symptom leads to persistence of pain and inability to do what you want in daily life. Treating the source will get you closer to the answer that you are seeking. So I hope that was helpful. Again, if you have any questions or comments regarding whether you think it may be your hip or your back or both or something else, by all means shoot me an email, andrew@zangpt.com. Post in the chat bar below. I will get back to you, and I hope you have a nice day.